Hi, my name is Colleen Ryan, and I'm a surgeon who has treated patients with burn injuries for over 30 years. Survivors of burn injury face multiple challenges in returning to their lives following injury. One of the most poorly understood areas is how burn survivors reintegrate into the community. It is really useful to define community reintegration following burn injury. If we can define it, we can use technology to measure it. If we can measure it, we can have benchmarks that can light the pathway to recovery for these individuals. We can use these benchmarks to allow patients, providers, employers, and payers to plan for burn recovery. For example, we could help survivors and their families understand the impact of injury on their family, or help insurance companies or workman comp providers to plan for resource allocation following a claim. We can assess the effectiveness and efficiency of existing and new therapeutic interventions and optimize them. Hopefully, through these efforts, we can improve the speed and extent of recovery for these individuals. To do this, we gathered an experienced team of individuals with different areas of focus. These include Dr. Lewis Kazis and Dr. Alan Jetty at Boston University, myself at the Massachusetts General Hospital and the Shriners Burns Hospital, and also Dr. Jeffrey Schneider from Spalding Rehabilitation Hospital, and Amy Acton from the Phoenix Society to represent the patients.
The study goals are 1, to develop a specific burn survivor questionnaire for tracking social participation, 2, to integrate the latest technology for constructing metrics using a computer adaptive test, and 3, to apply CATs, computer adaptive tests, to population-based studies, clinical trials, and patient feedback. What are the implications for survivors? First, we can provide survivors and their families with information regarding recovery that's important for providing needed support and care. Second, we can enable survivors to better understand the recovery. And third, enable survivors to better communicate their needs to their doctors and other clinicians. To explore this topic, we researched the literature, examined previously used questionnaires designed for burn injuries as well as other conditions, and held multiple focus groups with burn survivors and experienced caregivers, and came up with 4 major areas of substance, each with 2 subdomains. The first area is major life areas and domestic work. This includes work and employment as well as domestic life. The second is community, social, and civic life, which includes recreation and leisure activities as well as relating to strangers. The third is intimate relationships, which includes both romantic and sexual relationships. And the fourth is interpersonal relationships, which includes relationships with family and informal relationships with friends, neighbors, and peers.
Hi, this is Lewis Kazis at Boston University. The study timeline for this project includes 5 years, in which for year 1 we created the item pool based upon comprehensive literature reviews and focus groups that were conducted with burn survivors as well as clinicians in the care of burn patients. In year 2, we field tested, or we plan to field test the item pool, this is a questionnaire of about 200 items where administrations are basically over the telephone. Year 3 includes a preliminary psychometric evaluation using the technology that Dr. Schneider mentioned, which involves computer adaptive testing, and in year 4, we plan on pilot testing these results to look at responsiveness to change and to pick up the specific areas of the conceptual framework that Dr. Schneider talked about, which will include specific metrics for each. And then finally, dissemination of the computer adaptive tests nationally will occur in year 5 to burn survivors and their clinicians. The CAD administration, or the computer adaptive test, involves an item bank that's behind the scenes, where in fact selected items are asked of the burn survivors specific to their abilities, and in effect will allow us to put those individuals on a metric with reasonable precision for each of the conceptual areas that were discussed. The significance of this work is that questions are specifically designed to measure social interactions, work reintegration, and personal relationships that are practically non-existent for burn survivors. The computer adaptive test will be administered to burn survivors and scored to inform clinicians and patients, importantly, in routine clinical practice using technologies such as the iPad.
This work has important clinical implications. First, it would be able to provide real-time feedback for each survivor for their doctor's appointments. For instance, you go into the doctor's office, you take this test, and you and the doctor can review this list of symptoms or ways that the burn injury has affected your life in a comprehensive fashion, and it should open lines of communication with you and your doctor. You'll be able to see how you are doing compared to other patients with similar injuries. With this, it can screen for a range of issues affecting your social participation. Furthermore, this information can be used to identify the needs of the entire population of burn survivors and design new therapies and test new therapies using this data, making sure that it's the patients that decide whether or not a result is a good outcome. Once again, if we can measure it, we can optimize it. We urge you to connect with us. You can follow us on this website or this Facebook address, or contact us through email or by phone. Thank you very much for your interest in LIBRE.